Oprah, the woman who seems to have it all together, apparently has a little problem with stress, actually a big problem. She recently admitted that she was on the verge of a nervous breakdown.
Yeah, that term, nervous breakdown, we know is thrown around a lot. So what does it really mean, or is it just simply overstressed? In today's Doc Hollywood, we're sitting down with a family medicine physician from HealthPartners Clinics to talk about that and other celebrity health headlines. Dr. Paul Lysne, a family medicine physician at HealthPartners Clinics. Nice to see you, Dr. Lysne.
Good to see you. Thanks for having me.
Well, thanks for being here. You know, we're going to start with Oprah, who a lot of us look at Oprah and think she can do anything. She's invincible. And she admitted last year, she said that she was on the brink of suffering a nervous breakdown. She was so overwhelmed. A lot of us can relate to feeling stressed. Let's talk about the differences between some of those things. Stress, anxiety, or a full nervous breakdown.
Right. Stress is very common. We all get it. You get it. I get it. Pro quarterbacks that can't find receivers get stress. So stress it's a feeling of frustration or anger, tiredness. So the good thing is once the situation resolves, it usually goes away.
Okay, so what about an anxiety attack? What do we mean? Because a lot of people throw that term around.
Well, anxiety is sort of like stress, but it's a little more severe. In addition to the symptoms of stress, a person has a sense of fear or dread and just excessive worry. And what makes it different is that they can't get done with their daily activities. They just can't function. Nervous breakdown is kind of a further extension of that. Now, in medical terms, it's not really an official term, but it refers to severe anxiety or probably depression. There's a sense of sadness and hopelessness, and people just lose interest in things that they used to enjoy doing.
Okay, so at what point do we need to go and see a doctor and start to get some treatment? Because stress, we're all going to have that.
That's right. Well, I think when it gets to the point where you know other people notice and you can't focus on your job, and then it's time to get help and see your doctor, because there are things that you can do to help nervous breakdowns and anxiety.
Next up, LeAnn Rimes, country singer. She had to cancel a performance in Dublin, Ireland, because she was having these severe coughing spasms. It's either allergies or a cough or the cold or the flu. What are we dealing with at this time of year?
Well, I think LeAnn was probably dealing with an upper respiratory virus, or common cold, we call it. Symptoms of that would be nasal congestion and sneezing and runny nose and coughing or hoarse voice. Typically with allergies, there's a lot of sneezing and itchy, watery eyes, and the mucus tends to be clear with allergies. Plus, allergies don't get better in a week. They tend to hang on.
So now we're heading into flu season. Any symptoms to watch for there?
Typically high fevers and body aches and headaches. People say that they feel like they've been hit by a truck. With the flu, rest is the best thing, washing your hands and staying away from people that might have flu symptoms.
Harry Styles, One Direction band member. I'm sure you're a fan, Dr. Lysne.
My daughter's favorite band.
Oh, see, then you're totally up to speed. Well, your daughter must have been horrified to learn that he had quite an injury this last week. He had a fish hook stuck in his backside.
Right.
Okay, what's the course of action there? I hate to laugh because it probably hurt.
Well, you have to be concerned with infection after you've removed it, because it hasn't been in the cleanest places. So if you get a fish hook and it's stuck in there good, then it's time to go to a clinic and have it removed. Those fish hooks, they're meant to go in one direction, if you will, and if they go backwards, they cause damage.
Well played, doctor.
Right. Certainly call your doctor if you see signs of infection. Plus, you want to get a tetanus shot if you're not up to date on that.
Thank you so much, Dr. Lysne. I appreciate your time.
You're welcome.
And you can vote for next week's Doc Hollywood topic. You could win a subscription to People magazine to keep you up to date with all the celebrity gossip.
To enter, text Doc1, Doc2, or Doc3 to 42379 for the topic that you want to hear about next week. Choose from: Kendra Wilkinson suffers a stroke during an accident, Dr. Drew survives prostate cancer, or Daryl Hannah breaks her silence on autism diagnosis. And thanks so much to HealthPartners Clinics and Regents Hospital for sponsoring Twin Cities Live. Remember to check with your physician if you have a health concern.
Okay, next up.